The support that you have given Llamau and Upstream Cymru is so appreciated. We could not have done without your support and friendship. So we're now a year in Llamau into our pilots. And despite a pandemic, not exactly the best time to start universal screening in schools, what we can say categorically is that universal screening and allowing young people the voice to self-identify brings a depth and a richness to our knowledge. It gives us hitherto unknown information and data that we can act on and act quickly. It puts us in touch with young people that the current systems have yet to reach. As we always say in Llamau, it's not people who are hard to reach, it's that we haven't worked out a way to do it yet. Upstream Cymru does exactly this. We can also see that Upstream Cymru can and does complement school-based frameworks and education frameworks. It's an absolute joy to see colleagues in England, Scotland, Ireland and Europe looking with interest at our work in Wales. And I can honestly say at Llamau, we'll be delighted to support you however we can, in the same way our colleagues in Canada and Australia have supported us. I am very, very proud of the improvements Llamau have made with Upstream Cymru. And I really want to thank the local authorities, their leaders, the schools and the head teachers, all who have been brave and innovative in working with us to bring a trailblazing new early intervention approach to Wales. I must also thank Cardiff University, Pete, Erin and the team, and Llamau's amazing Sam and Talog and the Upstream Cymru team. Now we've got a pretty tight and busy schedule, so my job today is to try and ensure that every contributor has their allocated time, so I will be pretty strict. I'm also going to ask, please, can you post questions in the chat? And Pete and Ellen are going to try and keep a record of these so that we can then pose them to our amazing contributors. So, welcome to Moving Homelessness Upstream in Wales. I'm thrilled to pass over now to where it all began, learning from the Geelong Project. So I'm going to pass you over to Dr. Tammy Hand and Professor David Mackenzie. Welcome both.
Thanks, Frances. Thanks so much. Whoops. I'm just getting, I had some stuff on screen. It's now okay. Look, we're delighted to join you, and we are all part of a movement for change, as you have outlined, and that's exciting, it's challenging, and it's wonderful that we can actually join this webinar, even though we're on the other side of the world. So we are truly, really happy to be here. I'm going to set a little bit of context. We're going to keep to our 15 minutes. Tam is going to talk a little bit about how we've done certain things and emphasize a few points that are not necessarily obvious. And then I'm going to move on and give a brief update of where we think we're up to and what we're doing and where we think we're going. So firstly, look, Australia, for reasons I don't fully understand, we discovered youth homelessness very early on. We discovered it in the late 70s and the early 80s, and a lot happened during the 80s. There's a lot of advocacy by the community sector around youth homelessness, when I don't think anywhere else in the world it was sort of focused on as a particularly needy group. 1989, we had the newly formed Human Rights and Equal Opportunity Commission launch its first inquiry, and our friend and colleague Brian Burdekin was the commissioner at the time, and he decided that youth homelessness was the issue that he was going to focus on. And the report, Our Homeless Children, is still a landmark moment, if you like, in the history of this issue. Now, in Australia, about a third of all the individuals who are supported by homelessness services in Australia every year are children and young people. And about 16% of clients of the system are adolescents and young adults, 15 to 24, that are on their own. And yet they don't get access to social housing to any extent, 2.9%. Now, I should say that we don't have the sort of same quantity of social housing in Australia as you do, I think, in the UK or in Europe, and it's not managed through local government. But young people don't get in there. Young people mostly leave homelessness service, about half of them become homeless again. Now, we did do some things right. We did get some things right. In 1997, a task force focused on some of the early research on early intervention that I was involved in with a couple of other colleagues. And that led to the Reconnect program, which is being kind of reproduced in a slightly different form in Canada, which is great. And it's probably, I think, the world's first early intervention program for homelessness. And it was for homeless young people. That's a program that's still with us, about 200 workers around the country, and it's just there. It's been probably one of the longest running programs that we've had in this area. There was a Labor government white paper in 2008 that promised to halve homelessness by 2020. Well, we're now in 2021. A good start was made, but look, for reasons I won't go into, for reasons of time and perhaps a few other reasons, the plot was lost. And there's more young people who experience homelessness in 2021 than there were in 2008. Now, Australia has a pretty well-developed crisis system. We don't have shelters like you have in the United States and some in Canada. But the truth that kind of, the penny that drops that really is an unavoidable kind of point of logic, that if we continue in Australia or anywhere else to continue to pour money into more and more and more crisis responses, then there's no way that we can reduce homelessness. There's no way that we have. We've done a lot of necessary emergency measures in response to COVID. We moved people into hotels. A lot of things were done that were absolutely necessary. But one of the worries we have is that our governments may make a virtue of necessity. And instead of moving more strategically into housing options for young people and early intervention, if they persist with crisis accommodation, then we are in serious trouble. The question that arises, I think, is why has it been so difficult to shift policy and practice and programs to early intervention? It's an interesting question. And someone recently asked me this. And a few thoughts are that, well, it's what people see. When people go into the centre of Melbourne, there are going to be some people sleeping on the street. People think that's what homelessness is. It's the typification that's in the popular imagination that the general public has. And yet really only a very small percentage of people who are homeless on any night are actually sleeping in the city or sleeping rough. Most people are in some sort of temporary accommodation, couch surfing or things like that. The crisis system is, our system is largely crisis system. If you talk to workers, as Tammy and I did in some research last year, you're talking to workers who are at frontline services, usually under a pressure of unmeetable demands for assistance. And if you ask them what needs to change and what do they need, they'll say, we need more crisis services. And their response is understandable. It comes from their lived experience of just dealing with crisis after crisis after crisis. But this is not a critical systems perspective on what we need to do. And thirdly, to be more critical of ourselves in the community sector, many homeless agencies operating crisis services persist in advocating for more crisis services and mount cases for funding based on the demand for services data. That's part of the problem. We've got to be realistic about that. For their part, politicians have tended to respond by putting more and more resources into crisis responses. And so the problem of homelessness continues, and the number of people seeking help from the SHS system in Australia, or the Specialist Homelessness Service system, incrementally increases year by year. And really, what do we do about it? I'd been involved in research around early intervention and homelessness, and we had the opportunity in 2010 to do some research on whether it's possible to reach young people at risk prior to crises. So we had a whole load of research money, which was terrific at the time. And then we got some innovations money from the government, which the first lot of it anyway, and the Geelong Project was born. It was the pioneering prototype community site, and the development work was really co-development. There's myself as an academic working with practitioners on the ground with a terrific agency to really explore how we could make the difference. And we lost funding in the second round, and with no extra funding at all, we reorganised ourselves in the community. And that's when we really achieved the first notable outcomes, which Francis referred to earlier on. We now have 2 funded sites in New South Wales under the New South Wales Homelessness Strategy. And we're working with about 10 other groups in Victoria mainly, but also in New South Wales, or what we call COS initiative groups. And these are groups of agencies or people from schools who are working with us to develop an agenda for change with no funding on the table as yet, but they want to adopt the model that makes the difference. And it sort of starts with some measure of discontent. We've just created Upstream Australia as a not-for-profit company with tax concessional status as the systemic backbone support platform to support the implementation of the COS model and the communities of schools that are doing it. So that's just a brief context. I'm going to turn it over to Tam now to make some comments about how we've gone about developing this work in Australia, and then I'm going to come back and give you an update of where we think we are and where we're going. So it's over to you, Tam.
So I'm just going to briefly talk about some of the key lessons and points around this work, starting with the COS model. So I thought that I might just share with you all how we conceptualise the COS model here in Australia. So the Community of Schools and Services model, or COS model, is an innovative early intervention, service delivery and reform-oriented model for addressing and supporting vulnerable young people and their families to reduce disengagement from education and early school leaving, and to help where family issues are heading towards a crisis and possible homelessness, as well as other adverse outcomes. Excuse me, you'll see on the diagram that there's the different points of the COS model. So I'll just speak briefly to those. Now, the first one is collaboration. Well, look, everyone collaborates, don't they? You know, this is what we're all told. And it's one of those overused and probably abused terms, and it has different meanings for different people. So what we mean here is that collaboration is about building a community collective. So these are new institutions, if you like, and we consider this as the firm foundation for everything else that we do. Population screening. So this is a key innovation for early intervention. Ideally, the entire school population is part of this process, or as much of the school population as possible. What I want to mention here is that for practicality, this needs to be an opt-out consent for parents. However, for the students, the informed consent required is active consent. This took us some time in Australia to achieve because it's so different from the existing practice when we're looking at opt-in and opt-out consent. And we're certainly not asking for, you know, some sort of change to the ethical rules and practices. What we're arguing here is that this work is the exception. Practice framework. The point here is that early intervention works with a cohort of at-risk young people over time, and in fact, for the duration of their school years and hopefully beyond. We describe the work as youth-focused, family-centred support. So outcome measurement. What we mean by this is a community-wide outcome. Ultimately, you know, this is not simply just KPIs for a contract or for contract management purposes. Using the AIAD survey for monitoring and outcomes measurements is one of the roles that we have at Upstream Australia in the embedded work that we do with each of the COS communities. I want to make just a quick few brief points about collective impact, because this is the structural model for the specific methodology of the COS model. So if you wouldn't mind changing to the next slide for me, please, Erin. Are you able to change the slide, please? Thank you.
Changed. Yep.
There we go. Fabulous. So by collective impact, we refer here to the understanding of collective impact, which was coined by Kanya and Kramer in their seminal article in the 2011 edition of the Stanford Social Innovation Review. You hear a lot of claims about collective impact, and they often don't stand up to closer scrutiny. So, for example, some initiatives that claim to be doing collective impact don't actually meet all of the elements or characteristics of collective impact. And I don't think that we're actually vulnerable on this point here. So building the common agenda and the community collective takes between 6 and 12 months in our experience, and that's for each COS community. So this is not just network meetings, but this is the building of new governance structures and the building of deep relationships and partnerships to undertake this work. Sharing data is covered by the data management role of Upstream Australia. This is part of the Systemic Backbone Support Platform, and this is ongoing work with the community. To the right, you can see that backbone support is one of the 5 core characteristics of collective impact. The COS model operates with 2 levels of backbone support. There's local backbone support, which is provided by a project lead in the lead agency in each community. And then there's Upstream Australia, and we work as the systemic backbone support. Mutually reinforcing activities is the work with young people and their families and other interventions that we can layer into this work. So then there's shared dialogue and decision making. This probably seems obvious for a community initiative, but a collective of stakeholders needs a lot of work. You know, events that bring people together, building and sustaining new governance structures, sharing of information, consultations, and the like. So we have established an Upstream Australia Community of Practice network as a learning network backed up by a website that's about to go live as a way of supporting a much larger group of communities while having a relatively small organisation doing this backbone support. We also produce written documents on different topics and issues, and we've held several webinars with our COS communities. In late 2019, just before COVID hit, we convened our first face-to-face practice assembly where we brought together a large number of staff from COS communities for 2 days to share and learn from us and each other, and it was just fantastic. We plan to host another one this year, but we're going to do it online because of the COVID situation. And just recently, we convened a virtual National Youth Homelessness Conference. There was just over 550 registrants, and this conference was designed to launch a national strategy to end youth homelessness in Australia project. And this is probably a good time for me to hand back over to David so that he can talk a bit more about where we're up to.
Oh, thanks, Tam. Okay, I'm going to give you a bit of an update of where we're up to. And I guess in a nutshell, we think we've reached the point where we face the daunting challenge of scaling up the COS model. We're beyond the single pilot. We've got 3 funded sites. Where do we go from here? So what I would say is that developing and piloting and innovation is one set of demanding challenges, but scaling up in implementation involves a whole set of new challenges, and that's what we're currently facing. Now, we have mentioned in passing a couple of times that there have been 2 parliamentary inquiries. There was a federal inquiry, which was no big deal, just produced a report that no one reads. But the inquiry in Victoria really paid attention to the reform agenda that we have represented and took great interest in the COS model. The main message of that inquiry is early intervention. And we are currently working with the inquiry chair and other people with 7 communities and 5 agencies to get a commitment from the government. So we're putting up a consortium bid. We have the support of the inquiry, and we're engaging the ministers and the government to work out how we might do that. So that's quite challenging, somewhat nerve-wracking until they give us $39 million across the communities. The largest philanthropic foundation in Australia reached out to us last year and we've been in discussions with them since last August. And that's been an interesting process. We've been told that we're on a funding track. It's a pretty slow train, but that's okay. We're building a relationship with them, and they work in terms of partnerships, and they work in terms of significant funding to the partners that they support. And I think we've come to their attention because of the significance of the work and the growing base of support for it. Look, it'll be an absolute game changer if in fact they come good with that, and we'll see how that comes to pass. Systematic change, or systemic change rather, takes time, and we're really talking about more than a decade of intensive and development work and implementation work. We're not naive about the time scale of the work that it takes, and you know, that's something that's in train at the moment. Tammy mentioned the National Strategy to End Youth Homelessness Project, and when we convened that conference, it wasn't a standard conference where people just come and talk and share stuff. The whole purpose of the conference was to actually be the springboard for this project. And the project is posed and proposed as a joint government NGO sector venture. The budget that we've put up is 1.2 million, 400,000 from the federal government, 400,000 from the states and territory governments, and 400,000 from the community sector and philanthropy. I should say that we have no money in the bank at all yet. However, we are engaged talking to all of the Australian governments, the state and territory governments. We've had a second meeting with the federal minister. In fact, just yesterday, I was meeting with him and with a colleague, and we had a good meeting. He did say in the course of our discussion, no, 400,000 is not a problem. And we thought, well, that's good. He seemed to like what we were proposing, and he said he'd get back in a week. So we took that as a pretty positive indication that the feds might come to the party. And we certainly have had some positive indication from a couple of other governments, but it's a slow process to bring this together. And we think that if we can pull this off, it will be one of the most significant moments in the history of this issue. And we're certainly doing everything possible to make it happen. We have an advocacy strategy in addition to the work to scale up in Victoria, which is our immediate priority. We have the 2 pilot sites in New South Wales. We're engaging with the government and significant people there. But that's on a longer timeline. So the funding for those pilots ends in June 2022, and we'll have a whole lot of things in train. We'll be agitating around the community sector and contacting with homelessness agencies, and we're looking to the 2023 budget. We have a series of necessary projects in the design stage, and to mention one of them, we're very keen to explore extending the architecture and basic methods of the COS model to early school leavers. Now, what we do know in the Australian context is that...
David, can I give you a 1 minute warning, please?
Only 1 minute, not even 1 minute. That while early school leavers are not necessarily homeless when they leave school, they become particularly disadvantaged, and they tend to come into the homelessness system later on, and 2/3 of all of the people who go into the homelessness system, in fact, left school early. So lastly, and to conclude, thank you, Francis, I want to emphasise that this is all a collective effort. Academics like ourselves, leading practitioners and agencies, and people in government who understand what this is about. It's through our collective efforts that this movement for change can succeed. So on that, I'll finish and pass it over to our colleagues in the next segment.
Thank you so much, David. That was amazing, and thank you so much, Tammy. I think what is resonating in my head is if we persist with crisis intervention, we are in trouble. That is a message that we're all hearing loud and clear. And I think it also shows how important our funders are. And I just want to say a massive, huge thanks to Upstream Cymru's funders, because you are all leaders in the fight to end youth homelessness. Good luck to our colleagues in Geelong. Thank you for supporting us. And we will look at the COS model with interest, and we will all learn from each other. But I think that collective efforts is what is so important. It's now my absolute pleasure to hand over to a very esteemed colleague. So Talog is going to give you some early lessons from the pilot of Upstream Cymru. Over to you, Talog.
Hello, good morning, everybody. Right, I'm going to try and do the techie stuff for sharing my screen now, so bear with me a second. Where is it? There we go. There we are. Has everybody got that? Yeah, okay, people nodding. Okay, well, good morning, everybody. I have two bad habits. One is talking too much about Upstream, and the other one is talking too quickly. So if I do either of those things, I'll be trying to fight the urge, but I've got a lot of slides because there's a lot I want to say. So I'm going to be talking mostly about the practicalities of kind of getting this off the ground over the past kind of year and a bit. And then the last slide, which is probably the most important, is things that I wish someone had told us before we started, which is just kind of in the Welsh context about how we kind of get this kind of working here. So it was a drizzly day in January 2020 when we all got together as a new team. We'd been recruiting through the new year and got together for the first time. We were so keen, in fact, I think some of the staff had taken time off their former roles to come and be with us for our kind of launch. We got through we started staff training, established the governance and identified the schools in the first few weeks. I think identifying schools was a key thing. We worked very closely with the local authorities, and part of the process of identifying the schools was to look at the data that we had from our existing mediation services as to where young homeless people were coming from. Also work with the local authorities and talk to the schools as well, because I think what's become clear for the pilot is having schools that kind of are really wanting to engage with kind of new types of pastoral care for their pupils. Yeah, we identified a number of schools ready to go. February came and we worked with Do It Profiler, who've been fantastic in helping us get the digital survey. I'll talk about the advantages that I found with the digital survey in a moment, but yeah, we got a digital survey from Do It Profiler. We met with the schools, we worked with one of the local authorities, RTT, in developing the GDPR, which kind of backs up kind of, you know, the data that we collect and things, and we put all our paperwork in place. March came and the staff visited the schools. We saw our desks, which was fantastic. We were getting excited by this point because up until now we'd all been clustered around one desk in the office in Caerphilly, but seeing our desks ready to go in the schools was quite exciting for us. We had our first survey booked for the 2nd and then another for the 3rd of April 2020. And we were feeling quite proud of ourselves at this point because we were a new team and we were kind of steaming ahead, really. Then Armageddon kind of struck. We had a bit of an adventure as a global population, I think. So basically, the schools needed to close. I'm not going to say the C word because everybody has their own stories about that, but COVID happened. So all the schools kind of went into closure. We believed at the time that we were probably looking at schools reopening after Easter at this point. So this would be kind of end of April 2020. So we were kind of working on that premise. But in the meantime, we were in conversation with the local authorities. We contacted the newly formed local educational hubs that have been set up to work with vulnerable children. And we contacted children's services and children's services managers and started basically saying, look, we've got trained staff here. We can't do a survey, but we can take direct referrals and try and help out where we can through this crisis. And that's what happened. We started taking referrals direct. It took a little while to get that off the ground, primarily because it wasn't just us that were contending with the new way of living. It was everybody else. We had pupils at home, teachers at home, social workers largely at home, lots of people kind of adapting to the new world. But by kind of early summer, May, June, we were taking referrals. The schools opened on June the 25th, and we were back there in the classroom for most schools providing support. But at this point, it was direct referrals because we just could not get the survey run. Pupils were still largely at home. Our survey, I don't know, I said this in a meeting the other day, I don't know who had the foresight to decide on a digital platform, but that has made my life much, much easier. And I think just generally engaging with schools and pupils, the digital platform has been fantastic. It's anonymous from the start. The way the system works is we allocate usernames and passwords, and the young people then in school are kind of allocated their username and password by a teacher who makes note of it. So we never get the young person's name. but we get their username, so we can look at the data, work out which usernames might need support after they've completed the survey, and then talk to the school about who that pupil is, and then work with them to kind of make that possible. Setup is really quick. I've had phone calls sometimes at kind of 8 in the morning saying that the school had a chance to run a survey that day, can we sort it out? And kind of quite quickly afterwards, we've managed to get usernames and passwords to them. The results, one of the things that I would say about the app, what's so good about it is I can be in a classroom with teachers delivering the survey, and as young people are filling out the survey, on my mobile phone, I can show the teachers the results coming in, the bar graphs move, the pie charts go up and down, and that's a really engaging tool, just at a very human level. You can see the information and the interest coming in, really. Scores can be measured across classes, across schools and across counties. We can do it kind of pilot wide and then narrow it and focus it right back down to the level of an individual pupil, which has been really useful for us. Following initial setup, as soon as the usernames and passwords are there, what we found is schools can be quite self-sufficient. As soon as we've done our kind of admin bit and provided them with the details. Some schools have been keen for us to be on site during survey days. Other schools are quite happy to kind of get on with it by themselves. Some schools are more reluctant to have lots and lots of visitors at the moment for obvious reasons. So some of the schools have been doing it themselves. Data, as I said, am I talking too quickly? Someone shout at me if I'm going too quickly. Analysis is instant. As I said, you can see the data coming in. The schools remain in control of all the pupil data. We've got the kind of global data, and we can see how individual users have answered, but the school kind of has ownership of the data. Data is available to target early intervention. I think picking up on what our colleagues across the world had said, early intervention is the key to this. This is not reactionary. It's about trying to identify pupils earlier and before they come to us as in crisis. Because if a child is coming to you upset, that's kind of, you know, your crisis managing them to a certain degree. So this is about spotting them before they come to you. The data is available. Obviously, Cardiff Uni are hosting this today. The data is available for research, and I think it really complements some of the stuff that we already know about pupils. It's complementing, you know, all the data streams that we have, like the VAP and stuff. So it's just just more data on top of what we have, and quite kind of valuable data. What we've learned from being in the schools, I think. One of the things that shocked me most is just how unique every British school is, or certainly every school in Wales that I've worked in over the year. Even schools that are 2 miles down the road in the same county have a completely different personality to them, and that has been quite striking. So I think what's key for us is we have needed to learn to fit into every single school separately. So staff who work across 2 schools maybe have very different relationships with both schools, because that's what schools need. So it's about us being able to be flexible and fit into those schools and fit into that community, really, because each school has got its own community. Complementing pastoral teams, we're not there to kind of, you know, we're not there to kind of take it all on. We are quite specific and targeted in the type of support we offer. We are there to look at youth homelessness. And although the kind of markers that lead to that are quite wide-ranging, we are quite focused on the pupils that we work with, but we work with the pastoral teams. They know their pupils to a large extent, even if they don't know everything that's going on for those pupils. They do know a lot about them and their families, so we work with them. Building links with other agencies, but I'll talk in a minute about some of the other issues that are coming up, but it's really important that we're working with our other agencies on kind of the support that we don't offer, but the pupils need, and as I said, being flexible. Pupil responses. I've been on sites during quite a few of the survey runs, and the pupils are completely unfazed by it. They come into the IT room, they're very chatty. It's quite fun in a lot of, I think the best fun I've had so far was doing one of the PRUs in Cardiff. It was a fantastic day. The young people were brilliant with that, completely unfazed by doing the survey. I think a lot of them find it quite a familiar format. I don't know if that's because it's IT based and it is very BuzzFeed-like, our survey. It's kind of clicking on different responses and things. So I just think they're kind of in their comfort zone already. The questions are maybe quite challenging, but the way that it's delivered is quite accessible. I think what's important from the pupils' perspective is we work around education, so we're not pulling them out of too many lessons, but even when we're providing support and things, we're trying to work with the school around that sort of thing. Implementing support, Michelle is going to talk a bit more about this, but basically what happens is we target pupils. The survey pulls out pupils based on red, amber, green, and we're able to kind of highlight kind of at a glance who might need support and who is possibly doing okay. We then have discussions with the schools. We can go in deeper dive into the data to find out kind of how specific pupils have answered questions, have conversations with pastoral teams, and then if need be, have a conversation with the young person. Letters of introduction can be sent to parents, just kind of explaining what the service is again. And then we can basically get engaged with families via that then. Pupils are supported on site at home. At home is a new thing for us because we've been working mostly remotely, but we are getting there. And in the community, though we haven't done much of that lately because we've all been behind doors. Schools, just keeping the schools informed, being part of that school community and part of that staff has been really important. I think where Upstream is working best is where we're on site as often as possible, working with teachers and with the pupils. Obviously, any safeguarding issues, that's a shared concern for all professionals working together anyway. So far, I don't know if this might have changed again today because this survey's been run again today. We're at about 1,100 surveys. We've supported 114 families. 75 of those families came from the COVID response strategy, though that is sharply declining now as schools are open again. And what is on the increase now is the individuals that we supported as a direct result of the survey. So that's going up. Most of our referrals now are coming through us through that. And the next people, Michelle will talk about that more in detail now. Okay, partnerships. Upstream is not replacing other services at all. We are very specific. We work with the youth service in many schools. We work with school counsellors. We work with the pastoral teams. We are different. The data that we collect, it looks at resilience, it looks at homelessness, it looks at educational engagement, and it looks at well-being. That's a whole wealth of information there that schools can use to, identify pupils, but also make sure that they feel that they're doing okay in the areas that they need to. One of the questions is about bullying, for example, and I remember, a staff member saying they thought they had bullying.
There's 1 minute left.
1 minute, okay, I'm going to jump to this one then, all right, which is the things I wish I'd learned. Schools are really busy and focused on education, and even though they're to respond to kind of well-being and safeguarding, the biggest thing is nobody is actually at the moment asking children how they are universally. It's not something we're doing. We're waiting for young people to come in with crisis or come in upset or come in kind of after something has happened. That, to me, that's not really intervention. That's kind of crisis management. And I think that, again, as it's been said already, something we need to move away from. And breathe. There we are, Fran. I finished now.
Well done. Thank you so much, Talog. That's amazing. Talog is. I
could have talked all day.
And we love listening to you. I think that is so important. Waiting. We cannot any longer wait for young people to present in crisis or to present upset. Why are we waiting for that? When you think about it, it makes no sense whatsoever. Thank you, Talog. Can I just ask, I noticed people are putting a few questions in the chat. Can you resubmit your questions into the Q&A part at the bottom of your screen, please? Because there's some really good questions coming in, and it's really important that we are able to pick those up towards the end. So please, questions in the Q&A at the bottom, not the chat. Thanks ever so much. So it's absolute pleasure now to move forward to mediation experiences. And I'm very, very proud and pleased to welcome Michelle, one of our Talog's team, our mediation worker. Over to you, Michelle.
Thank you. Good morning. Thank you. Good morning. Nice to meet everyone. Sorry, I'm just going to share my slides. Sorry, technology. So good morning. I'm Michelle Smith, a family mediator in the Upstream Project. I'm here today to share my experiences. I would like to first discuss the two different services we provide, mediation and emphasis. Sorry, I'm just trying to move my... During mediation, we support the whole family. When there are arguments at home, it does not just affect the individuals involved, but everyone living in the house, such as siblings. We don't dictate the outcomes, but rather allow the individuals to explore and make their own agreements. We help them to identify their needs and concerns. We focus on the lack of effective communication, as this is one of the major key factors in causing conflict. We help individuals to improve their communication skills and how to talk to one another. Conflict resolution is an important skill where we show that not all conflict is negative. We equip young people and their families to resolve future conflict without the need of services. We guide participants to identify and acknowledge their emotions, as well as develop empathy. Emphasis, the young person receives individual support. The main focus is on exploring barriers to engagement, whether that's in school, college, or training. The emphasis worker helps the young person to develop their skills, such as filling in applications and arranging appointments. The young person is given practical solutions to build their resilience. Key factors to our success: to have a good relationship with the schools and other agencies. Having a good relationship with the schools and agencies are vital to the success of the project. As a mediator, you need to ensure you're constantly providing feedback. The schools are a wealth of information. They know their students and families. Schools can often provide background information. The teachers can report on any changes in behavior, plus provide knowledge on friendship groups, which gives you a full picture of the young person. For there to be clear understanding and services we provide, I've experienced a few misunderstandings of what I do as a mediator. You need to take the time to explain to the schools and agencies what services we provide, as well as educate the wider community. Teamwork. During the pandemic, I learned this well. Your team is your support network. You can share your cases with them, ask for advice, discuss different tools that you can try, review your cases, share your failures and success. Our team had daily briefings. Initially, I was thinking, what can we say daily? But I soon learned the importance of daily contact and support. We have a close-knit team who support one another without judgment. Being flexible, things do not go according to plan. You need to be able to adjust and go with the flow. I found sometimes the cases were not straightforward mediation. I had a case where a young girl was excelling in school and had left her family home because of her relationship with her mother. All she wanted was a good relationship with her mum. Her mum was an alcoholic and had her own support team. While mum went into hospital for detox, I worked with the young person to understand her relationship with her mum, so that when her mum was in a better place, we could then proceed with mediation. Being present in the schools is important so that staff can get to know you and you can build those relationships. It helps for students to get to know you. Sometimes a young person may be too shy to reach out for help, but if you've built that rapport and trust, they're more likely to ask you for help. Without a sense of humor, there would be many tears shed. If you can laugh at yourself, then you're going to be fine. If you allow others to laugh with you, you're going to be great. Some of the challenges we face: communication. During the pandemic, communication was a challenge for schools and other agencies. They found themselves in uncharted waters due to the pandemic, and our Upstream project was not always a priority. Not a clear understanding of our services. Sometimes the referrals we received were not appropriate for mediation, but were for emphasis. This highlighted for us that there needed to be information about the services made available for all. Engagement, getting young people to answer their phones when there's no school routine in place is difficult. Most of our calls fall out of office hours. Teenagers tend to come alive after 5 o'clock. That's where we needed to be flexible but firm with boundaries. There was not as much parental conflict because there was no school. Parents were not fighting with their children to get up and get ready for school, but most of the conflict was around about young people staying up all night on their technology and devices and sleeping all day. Our first case study, overview, A is performing well at school, which was doing really well, has a good relationship at school, attends regularly. A expressed the belief they are transgender and want to be male. During early discussions, Mum and Dad were both very supportive. However, when A discussed coming out, Dad expressed concerns and found it difficult to acknowledge the changes. During this period, it caused a rift in the family. There were arguments with Mum and Dad, which caused strain on their marriage. Mum felt the situation did not improve. She would have to ask Dad to leave the marital home. A needed some needs of A. He wanted better communication with Dad. A wanted to use the correct name and pronoun and wanted support with gender issues. The support engagement we provided, A and Mum engaged well. They were happy to take part in regular sessions. Mum was open and honest in her discussions and expressed at this point. A and Dad were not talking. Dad was refusing to call A by their preferred name. Mum expressed concerns about Dad's own mental health, and this was compounded by a sibling that had autism. Dad requested a male mediator and initially found the conversation difficult to express his concerns. Dad acknowledged that the world was changing, but still feared the world would be prejudiced, making relationships and employment difficult. As A was referred to Umbrella Cymru, Dad is used, and since then, we've had mediation. Dad is using the preferred name and pronoun. He still makes mistakes, but he tries. A feels that Dad is making an effort and the relationship is improving. Mum feels like the family is not arguing so much and a marriage has been restored. A is continuing with her support at Umbrella Cymru. Case study B. B witnessed his friend die and he feels that it's not been the same since. He has been excluded from school twice in the last month for aggressive and threatening behavior. There's a real concern about school disengagement and permanent expulsion. B is dependent on, emotionally dependent on cannabis, and he feels that it makes the day better. B wants to stop smoking cannabis, B wants to feel happy, and B wants to change their aggressive behavior. Some of the support and engagement we offered. Reduce antisocial behavior during discussions, their triggers and how they can appropriately respond. Find different ways of dealing with problems without being aggressive. Spoke about effective ways to communicate so that he feels heard and understood. Just understand that communication is a two-way street. Reduce the risk related to the use of cannabis. Refer to an agency to help with substance abuse. Plus, during session discussions, we discussed the negative behavior cannabis has on B's mood and aggression. B reports that he enjoys the support session as he feels listened to rather than questioned. B has reported using less cannabis most days compared to every day. B has reported thinking about how they respond and the consequences of their behavior before they react. Case study C. C suffers from anxiety. C has a strained relationship with school. She is a very anxious individual. The local lockdowns and the changes to the guidelines have not helped this. School has been flexible and offered her online learning from home, but also offered her a place in the hub where she could attend. C has autism and it affects her relationships. C requires mediation support with relationship with her mum. C received an autism diagnosis and unsure what this means and how it's going to affect her life. the relationship with mum became strained. Mum works night shifts and long hours, and C felt like their relationship was deteriorating. C needs to understand what her diagnosis means for her. C wants a better relationship with mum, and C wants to attend school without feeling anxious. The engagement and support and outcome. C and mum, they were both eager to engage from the start. One possible barrier that was challenging that mum works night shifts, which C found that didn't help her anxiety. The aims and objectives the family had were communication-based, communicate effectively. C wanted a physical, affectionate relationship with her mum and wanted more time with her mum. Mum wanted the relationship to have more consistent and be more consistent and have a good relationship. To talk to her when she was upset and speak about her feelings. They had consistent weekly support, either by phone or face-to-face, and C had to talk about her concerns and issues. C was very open and discussed her mental health along with their home life without difficulty. C has made improvements, and mum has expressed how things at home have improved.
Thank you so much, Michelle.
Thank you.
That was amazing. Thank you. It's so fantastic to be able to see what the difference that Upstream is making to individuals. Absolutely amazing, and well done on timing too.
Thank you.
Yeah, you got the gold star. You did get awarded from me.
Thank you.
Okay, folks, what I'm going to suggest now is you can see that we have a little bit just to have a comfort break and for people to make coffee. Can I ask that we all get back for 10 o'clock? Please feel free to put your cameras off. Please, can I ask, while you're having that cup of coffee, think about some more questions and things you'd like to pose to our amazing presenters. Please be back promptly at 10 because we still have a very full schedule. Thank you so much, folks. See you very soon.